My name's Maryann Copley, and I grew up out in Oregon. I ended up in the Midwest after college, and I'm currently a custodial supervisor on overnights. After several days of increasing pain and discomfort in my neck and my shoulder and chest area, I had really severe chest pains, and I was really worried it could be heart-related because I didn't know what it was, but it hurt so bad I couldn't even hardly sleep, and it was absolutely miserable. So I was like, if it's nothing, it's nothing, but if it's a problem, it's probably a big problem, and I should go get it checked out. So the receptionist there was really friendly, really positive, and she got me in a wheelchair and just walked me around to the ER and, told me I was going to be okay. And she quick walked me down the hallway around over to the ER department, and she talked to me the whole way there and just kind of kept up chatter that kind of helped give me something to focus on besides the fear that was really starting to develop at that point. Ultimately, they helped manage the pain by giving me some kind of medication through an IV. And it got down to where I was not feeling good, but basically comfortable. And that was incredibly helpful just on its own. But once it got down around a 5, I caught myself being able to breathe, and I was no longer completely afraid to take a breath. And I was like, wow. Everyone that I interacted with was professional, friendly, or if not actively friendly, at least, caring. They cared. They were doing their job and talking to me and respectful. They treated me like I was a person, and that was really nice. Not that I would expect otherwise, but it was definitely noticeable. It was, you're here, you're scared, you're in pain, we've got a job to do, but we're going to deal with you like you're a person who needs a little bit of reassurance. The thing I appreciated the very most was the nurse who, after she got the IV in, immediately called the lab and requested a tech come down to get the blood from the IV before anything else was hooked up, so that I didn't have to go through another needle poke, because she saw how terrified I was and how awful everything was for me, and had the thought to do what she could to make that easier. And I'm terrified of needles. Terrified. I can do steel myself for one blood draw and then we're done. That's when I'm not having chest pain to the point where I think I'm dying, and that stands out as a major thing that I will always remember. That was above and beyond the thing I will remember above everything else. She saw that I was distressed by the needle and I was trying really hard, but I was distressed and in pain and moving, and she decided to call the lab and ask them to come down to get blood, and I was shocked that she did it. I was amazed in the best way. And then the lab tech came and they did it, and I was just like, thank you so much. Yeah, that definitely is going to be the thing that stands out for sure. When I first saw him, I didn't know he was a doctor. He came in while we were trying to get the IV in. And I saw someone who was a medical person, not with full hands. And I was like, can you just hold my hand? And he just reached out, gave me his hand, and I just kind of squeezed him, probably pretty hard, I'm not sure. And at one point, the nurse was like, that's good, keep talking to her. And so I tried really hard to focus on him, and she got it in at some point. So my first impression of him was nice person who held my hand when I was completely freaking out and trying really hard to hold still. And I found out later when he came in to give me some results that he was a doctor. I'm like, oh. So I feel like that was a really positive first impression. So when I got there, they set up the EKG first, and they did that. And then we got the IV in, and they got some blood from there. And then after we'd ruled out some of the stuff that stuff's related to, after that, they took me into another room where there was an MRI, and we did some imaging. And then I went back in the room and waited for results. So, and at that point, I was pretty sure I wasn't about to die, so it was good. They ruled out any of the major, serious, urgent issues. I suspect it could have been a pinched nerve. It started with my neck, and talking to my dad later, he mentioned that it sounded almost exactly like his experience with pinched nerves. I'm like, that would make sense. I never even considered what it would be like without it because it was here. And I knew that. And I guess in the back of my mind, that's a reassuring piece that I know that it's here and there are good people here. Oh no, I would definitely recommend the emergency department there, because if you're having an emergency, they're going to treat you like a person with intelligence who they respect, and they're going to do the best they can for you, including things you never would have known to ask for. Since the moment I first walked through the doors at the Brookings Healthcare System for the first time, I have consistently been met with people who treated me with compassion and respect and good quality medical care.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.